and also to try and understand what are the key issues that we are still facing, the treatment paths that we are following, and also more importantly, what is yet unknown. And that's an equally important thing. So one of the questions that comes up in this is the environment that we live in. And is this environment particularly more conducive to the carriage of this virus, or alternatively, is it not conducive? And therefore, is the virus not propagating as much as it is perhaps in other countries or in other climates or zones, and in contrast, India is not seeing the same impact. So that's a question I'm putting now to Dr. Rajesh Chawla, a pulmonologist and who also handles critical care and pulmonary conditions at the Apollo Hospital in Delhi. Dr. Chawla, thank you very much for joining us.
Thank you.
So first question, and the straightforward one, is really, is our environment fundamentally different from other ones? And how does that either help or not help the carriage of this virus?
So far there has not been clear cut whether it can grow on a hot and humid conditions or not. Whatever they have seen so far is that it is growing in the hot conditions as well. But why it is not growing in India? It's a really, I think still there is a time to see whether we have that much kind of a growth as in the other countries. But I guess it is not going to be, because I have been managing the swine flu and H1N1. The way those were progressing, we're not finding so far that kind of a growth.
Right. But, and are you treating any patients right now?
Yeah, I am treating.
Okay, and what is the kind of conditions or symptoms that they came in with, and where are they right now?
So far we have patients in the isolation ward, and mainly elderly gentlemen, and with some comorbidities.
Okay.
And predominant symptom, most of them have just fever or cough. We are not admitting them, just advising them to be quarantined at home. But people who are hypoxemic or who require some kind of intensive care, or those are the patients we are admitting. And mainly, most of them, what we are admitting, they have a low oxygen and they require oxygen or some other respiratory support.
So is the low oxygen, do they come in at a point where they are low on oxygen, or is it deteriorate? They deteriorate and then you need to or have to give them oxygen support?
No, they come with low oxygen. The people who have the oxygen is all right and rest of the tests are all right, we tell them to be at home, quarantine, and don't come in contact with the other relatives, because it is not required to every patient to be admitted in the hospital.
Right. And amongst the patients that you have in hospital, you said that most of them are elderly, but are you able to say at this point how the treatment is playing out?
So far, they have been doing well. It is only a week they have been admitted, and it is the second week most of the patients deteriorate. So we'll have to see how they behave in the second week.
And what? And
but
what's the
number is not that much as you see in the swine flu. So far, even the government hospitals are not, except for the Ram or Lohia, I don't think there are many patients in every hospital. If you start admitting every patient, the hospital would be full. But I think it's really not required. Just quarantine in a separate room. And if they have any red flag signs like breathlessness or difficulty in speaking or difficulty in walking, or they have comorbidities, and if their tests are abnormal, there are certain things in the test which, when they are present, we admit those patients.
Right. And what is the kind of treatment that you're administering to the patients that are already with you?
We have been administering only the supportive treatment. That is what is recommended right now.
Mm-hmm. Could you elaborate on that, please?
Supportive treatment means you give them oxygen, you give them good food, control their sugar, control their blood pressure, and make them comfortable, observe any deteriorating test or sign, and then accordingly. Most of these patients, they have a predominantly respiratory issues, and the main is the oxygenation, which is low. So you have to keep oxygenation all right. So far, we are not ventilated, invasively ventilated. They require oxygen or the non-invasive ventilator.
Right. So, there are a lot of questions and perhaps concern about the kind of treatment that is administered to patients everywhere. And the Indian Council of Medical Research has also acknowledged the need or the use of, for instance, of hydrochloroquine. So, is that something that is, or retrovirals for that matter? So, is that something that's a common treatment path even?
Whatever has been published, whatever has been seen, none of the treatment so far has been found to be effective. People are using hydroxychloroquine, azithromycin, and some of the antiretroviral drugs like lopinavir, ritonavir, remdesivir. Even the small studies which have been published in a small number of patients, they haven't shown a significant difference in the conversion rate. Because you see, the basic purpose of all this is to decrease the replication rate of virus so that the multiplication slows down and the effect of this will slow down. But so far, none of them have been found to be effective, and these are toxic drugs. And recently, we read a report that one of the doctor had a cardiac arrest who was taking both the drugs prophylactically.
Yeah.
So I think these drugs should not be taken indiscriminately, only with a doctor prescription. That is what is recommended. And follow what the government has laid down, because these are still, whatever the Indian government is issuing advisories, most of them are based on some scientific evidence, and we should only follow them.
Right. Now, and you mentioned that you worked on swine flu in the past, and I'm assuming SARS as well. So what are the similarities that you're seeing in the progression and the ability of medicine to control or even improve the condition of patients?
See, we had the oseltamivir proven drug for swine flu or the H1N1. We so far don't have a drug which has been approved universally for this. Then the second difference was that was not that infective. This virus stays on fomites. Fomites means your tables, your handles, your mobiles. This virus can stay. But the swine flu was not staying. So the infectivity was not that great. But the outcome was almost similar. If you really ask me, that also used to present with a severe respiratory failure. Many of those patients requiring ventilators and the usual management which we do for the patients of ARDS.
And if I know that at this point, and I've been talking to the other associations or the Association of Hospitals as well. The sense is that currently most hospitals are operating at a lower capacity in anticipation of load, and therefore maybe they should not be too much concerned at this point. But however, that could change if there is a sudden surge in cases, particularly those that are serious.
I think the picture might become more clear by the mid of April, because that would have, if it had traveled to community, then the cases would start appearing. But so far it is good, and I hope people stay at home and they follow what has been said. Probably we may not have that much spread. I think these workers which have been traveling, I don't know how far that can have an impact on the number of cases.
Right. Yeah, because the migratory workers are essentially going back to places where medical support will be even lower than where they were earlier.
Correct.
Right.
But then, because in the city, the villages, they're not that close. Even the smaller person will have an open house with a lot of air and open places. That may have a positive impact also, but both ways. Yeah.
Right. So if we, since we are largely talking about a respiratory disease, is there something that people can do to essentially be more healthy, apart from all the other, the tips and do's and don'ts that we are familiar with?
I think now everybody should follow the hand hygiene, cough etiquettes. I think they have been told on media repeatedly. Wash your hands most of the time during the day. Anything you touch, anywhere you go, you don't know the housemaid who's come to work at your home maybe have infected and touched all the handles. So keep on keep on touching, when I keep on not touching things, and then probably I think keep on washing hands, even staying at home, then that habit will go into you and probably you will avoid a lot of infections in the near future. The second thing they need to do is, I think, exercise regularly, because if you exercise regularly, you avoid a lot of things and you become healthy. These are the two things. Eat a proper balanced diet. There's no need to eat too much when you are at home. You tend to eat too much, so don't eat too much. And keep on traveling inside the house. Don't be on the bed, because you may not get this, but you may get other diseases. So, and do whatever you wanted to do in your lifetime, which you could not do. Now there's a time, so you can fulfill those desires.
Right. Okay, great. That's a good note to end on. But just a last question, Dr. Chawla, as you were saying that the next week is going to be critical because the patients that you've admitted will go into the second week, and then if things deteriorate, then obviously it becomes challenging. So what are the ways that it could go from there, and what are you geared for?
No, we will manage them, but I guess probably they may not be that severe. They might have come late to us, but whatever is required, most of the time they get into the respiratory failure and other things. We are all geared for managing such patients.
Great. Dr. Chawla, thank you so much for joining us and sharing your thoughts, and I wish you all the best in your efforts at fighting this disease. Thank you.
Thank you very much.